system in every state. And rural Alaska, as you mentioned, as Dr. Oz mentioned, has often, almost always been an afterthought when it comes to investing in health care in America. And that's not happening anymore after the Working Families Tax Cuts Act. As you said, Mr. President, as Dr. Oz said, this is the biggest investment in rural health care in American history. $50 billion. The award the great state of Alaska was able to get working with Dr. Oz, and the parameters of the bill was about $1.4 billion over 5 years to transform our healthcare system. So that's really exciting, but here's the big deal. This is not just about money. This bill isn't just about money. The reason it's so impactful is that it's focused on letting states and governors design the system that they need. Alaska has many unique healthcare challenges, Mr. President, as you know, but for decades, the mentality in Washington, D.C. is this approach to one size fits all. D.C. tells every state, here's how you have to do it. And it never works. It never works. It certainly doesn't work in my state. I'll just give you one example. The federal match on Medicaid. Our state typically has the lowest match in the country, even though we have the highest health care costs and highest delivery costs in the country. The one size fits all doesn't work. This bill is different. This bill that we wrote with your administration is all about allowing states to design a system that works for them with CMS guidance. And this will be a generational opportunity for every state to bring health care closer to home, to make it more responsive to the people who live in that state, and make it more affordable. I'll just end with this, Mr. President. Like I said, a lot of excitement. We got Governor Dunleavy, who sends his greetings, was hosting the stakeholders in Alaska, and this is going to help my constituents, going to help every American, and it is really exciting, and I want to thank, again, you, Mr. President, and your team.
Thank you, Dan.
Thank you very much.
Oh, thank you very much. We're going to have to go very fast. We're going to have to go we are way behind schedule, and I have a couple of meetings that are very important. Nothing more important than this, but let's go. Come on, Bob. Rob?
Fire round.
Please.
Mr. President, thank you very much for having me here today. And I represent northeastern Pennsylvania. Your governor from Scranton, Pennsylvania, so never had the opportunity. I inherited a very similar problem. But before I was even sworn into office, I had two hospitals, Moses Taylor and Regional in Scranton, that were eminently facing closure. Right. And it's been, and working with Dr. Oz, Administrator Oz, and the CMS team has been absolutely incredible on so many levels. And thank you. Process. But when you're looking at Pennsylvania, we're going to receive over $193 million. In 5 years, it'll be over $1 billion for the Commonwealth of Pennsylvania. And when you think about northeastern Pennsylvania, clinics and regional hospitals, rural hospitals are the backbone of our communities. So making a targeted investment that is not just going to band-aid over poor operational procedures, it's going to actually transform rural healthcare. That's what we are so excited about. Pike County in my district is the largest growing county in the Commonwealth of Pennsylvania where there's not a hospital. The nearest commute to a hospital is over 55 minutes away. So these are going to be funds that will be so imperative. The unprecedented investment is going to be incredible, and thank you for having me up here and being a part of this journey.
Thank you, Rob. Appreciate it.
Thank you, Mr. President. This is a great opportunity to be here with you and your team. Dr. Oz has been a tremendous asset. The $50 billion commitment to rural health transformation is critical. New York State is going to see about $212 million in the first year, which is vital for workforce development, access to care, primary, behavioral, maternal, emergency, telemedicine, et cetera. How were we able to do it? Because we rooted out waste, fraud, and abuse in the system. Democrats will just say we cut $1 trillion in Medicaid. That's not what we did. We said you need to be eligible. You need to be a citizen. You need to work if you are able-bodied without dependent children. We reined in the provider tax and state-directed payments, which have exploded over years. And we are taking this money, not only preserving Medicaid for the IDD community, our seniors, our children, our single mothers, but we're investing it in rural health. When you look at Obamacare, health insurance premiums have risen 96% since Obamacare took effect. Insurance revenues up 2,000%. Mr. President, you are 1,000% correct that the insurance companies are the problem. They wrote Obamacare. It's to their benefit, and the American people are being screwed. And so we can get a bipartisan agreement on what you are trying to do. When it comes to lowering drug prices, I will tell you, one of the largest pharmaceutical companies is in my district, in Westchester County. I met with them in 2024 and I said, what would you do to lower drug prices? And the response was, go after the European price controls. You are spot on taking on the price controls that have been put in place. Most favored nation is the single best thing we can do to lower prescription drug prices here in America. The pharmaceutical companies will tell you that privately. Pharmaceutical companies, associated health care plans, we put that on the floor. Every Democrat voted against it, every Republican for it. Those would reduce costs by 11% because businesses, small businesses, would be able to pool together and purchase health care plans at a lower rate. We need to go after the PBMs and make sure that insurance companies are not owning providers and owning PBMs. That is what is driving up the cost of health care in this country. You've talked about IVF. I've been a big champion on this. We need to make sure the insurance companies cover it. I also have a tax bill to provide tax incentives to Americans, and what you have done to lower IVF costs on the drugs is critical. And you are 1,000% correct on expanding HSAs. I fundamentally believe that we can address the issues with Obamacare, make sure that the American people have access to care at a lower rate. We can get a bipartisan agreement to address the EPTC with expansion of HSAs so that the money goes to the people and not the insurance companies. We are committed to working to get this done, and I thank you for your leadership.
Thank you. Thank you. Governor Gillard.
Mr. President, gigantic thank you, and thank you for your incredible leadership. Your courage gives me more courage to say it the way it is. We're working very hard in Nebraska to run government like a business. This investment in Nebraska, you poll 85%. I don't know what the hell's wrong with the other 15, but your 85 is a pretty good number. I think, be very, very brief. This plan will allow us to do common sense, pragmatic investments in rural Nebraska, and they will be sustainable. We will make sure that we don't need another dollar after 5 years. We are working on simple things like food. Real food is good medicine. We're working on making sure that all of our veterans, Nebraska is 500 miles long, 250 miles wide, no longer are veterans going to have to drive to Omaha to get care. We're going to take care of our veterans at home. Investments in technology so we can educate our children in rural Nebraska to provide health care are really, really important issues. And I think that the other is we've developed what we call 6 Regions, 1 Nebraska, and that will focus and take advantage of those. So we're working on what we have and then being able to use these resources to also help us with mental health and drug care as well. So we're incredibly grateful. Nebraska, we work hard. We're about faith, family, hard work, the American dream, and we don't ask for much help in rural Nebraska. So we're really grateful for this investment. Thank you.
Thank you.
Thank you.
Thank you for being here. 1 minute.
How about 30 seconds? How about 30 seconds, sir? As a small town kid from Glen Rose, Texas, population 1,200 where I grew up, what you are doing today changes everything. And on behalf of our farmers and our ranchers in rural America, it is a new day, and we're so grateful. The final thing I'll say is I think about Abraham Lincoln, who also sat in this room, and I think about other presidents throughout American history. And you think about how the fundamental course of American history has changed in certain pivot points throughout history. I think about you as the peace president 8 wars solved, more coming. I think about you as the security president, a border that is secure for the first time and more than any time in American history. I think about you as the prosperity president. We talk about, Kevin, wages going up.
We'll give her more than 1 minute. In fact,
oh no, I'm almost done.
she can speak as long as she wants.
I'm almost done. The prosperity president and what's happening. Think about you as the affordability president. Everything is coming down. Inflation is coming down. The cost of groceries is coming down. Fuel, housing, etc. And sir, today, in the last 2 weeks, you will go down in history as the greatest president for the health of this country in history. Think about our new dietary guidelines from Bobby Kennedy and I, but with your leadership, putting real food back in the middle of our health care conversation. Whole milk for healthy kids with those dairy farmers 2 days ago. We were in Pennsylvania talking about it yesterday. And today, putting the patient and the doctor back in charge of health care with great leaders like Governor Pillen. God bless you,
Thank
your
you
leadership, and all of our leaders. Thank you so much, sir.
Thank you very much. You've been a great And Terry and Andrew, thank you. Thank you very much for being here. I hear you're just outstanding people and have really helped. We appreciate it. You want to say something?
Thank you, President Trump, and I would just echo everything that's been said here. Thank you very much for what you're doing. I'm from the northwest corner of New Mexico. We also work with the Navajo Nation,
Right.
and so we have a lot of rural areas in our state and in our county. I'm also a county commissioner, so I take as being a nurse practitioner, a county commissioner, with a heavy weight in order to see this happen. And it will help produce accessibility, which is a huge thing. People have to drive for miles in order to see a health care provider, workforce, quality care, and sustainability for our hospitals. That's what we're looking at. We meet next week in Santa Fe with our legislators. And so we're going to be addressing the licensure compact as well.
And they've got to clean up their elections in New Mexico.
We're working.
Because those elections are so corrupt, it's incredible. If they clean it up, we win by a lot, but they are really corrupt elections. So I think if you want to do this, you have to tell them to start working on that. It's unbelievably one of the more corrupt states in terms of that. But you uncorrupted, so I appreciate you being here.
Well, the
today.
Northwest Corner loves you.
I know.
Thank you.
I know we have great love in New Mexico, but it's the elections are so corrupt. Not much you can do about it. We have that with numerous states. Thank you very much. Andrew, thank you very much. You have anything to say?
Mr. President, thank you for having me here today. It's an honor to be here to represent my community. I'm from Northwest Georgia. I grew up in West Virginia. To represent my colleagues and my profession, it's truly an honor. This is so important to our patients, to put the physician and the patient back together and take everything else out of the middle. I practice in cardiology. Having efficient, effective, high-quality care is so important. And time is of the essence, and patients need to be able to have close proximity to their doctors to get the care that they deserve. It shouldn't matter about the zip code. We should be able to do what we are best at and take care of our patients on an equal playing field, and this certainly helps that. I greatly appreciate all that you've done for the American people. You are an inspiration to us. You make us believe no problem is too big to solve. I mean, you are a representative of that, and I thank you for your leadership. Thank you for this opportunity to be here, and thank you for putting healthcare at the forefront. It's so important to every patient and every family that we take care of.
Thank you very much, Andrew. Great job. Great job you both do. Amazing. I've heard unbelievable things. And doctors in particular, thank you very much for being here. We very much appreciate it. Thank you, everybody. It's a big story. Thank you.